Good afternoon. Thank you for joining us for End of Life Care Coordination. My name is Phoebe James and I'm a Professional Development Officer with the Hunter, New England and Central Coast Primary Health Network. Before we begin, I would like to acknowledge the traditional custodians of the lands we are meeting on today. I am coming to you from wet and rainy Awabakal land and pay my respects to elders past, present and any First Nations people joining us. I want to mention before we start, this session is being recorded. The recording and the PDF slides will be available in the Education Library on the PHN website in the coming days. After our presentations, there will be a Q&A session. So please put your questions in the question box and we'll try to get to all of them. It is now my pleasure to introduce Charles Broadfoot, Senior Project Officer, Palliative Care with the PHN. Thanks, Charles.
Thank you, Phoebe. Hello, everyone. Thanks for joining the webinar today. As Phoebe mentioned, I am the Palliative Care Project Lead for our PHN, and I'm pleased to introduce the session today. So the PHN is funded under the Greater Choice for At-Home Palliative Care measure. So this is a fairly new measure, new funding for PHNs. And essentially the funding goals are around increasing choice for more people to be cared for and die at home. So following quite a comprehensive needs assessment of our region, one of our key initiatives that we developed was looking at piloting an end-of-life care coordination service that sits in primary care. So through a commissioning process and a competitive tender, Baptist Care were our successful providers who will be delivering the service. From Baptist Care today, we have Kate Mole, who is the Central Coast and Hunter Area Manager for Baptist Care at Home. And also joining us is Kayleen Martins, who is the Head of Quality and Clinical Governance with Baptist Care at Home. So I'll shortly pass over to Kate to start the presentation, but I also wanted to introduce my colleague, Emily Parsons. Emily is the Health Pathways Project Officer, and she'll be providing a quick update at the end of the presentation on where this information sits on Health Pathways. So thanks again for joining, and I'll hand over to you, Kate, to start the presentation.
Thank you, Charles. And once again, an enormous thank you to you, Charles, as the project lead, and also to the PHN for opportunity to provide this incredible program, this pilot program, and the opportunity to share today as well. We're really excited. Baptist Care is very excited about the opportunity that we have to partner with the PHN in the delivery of this pilot program. I'm presenting to you today from Awabakal country as well. And yes, Phoebe, it is also wet and rainy here today. Charles also mentioned that Kay Martins, our Head of Quality, is also on the call today, and Kay will be joining me at the end for supporting any answering of questions that you may have regarding the program, and Kay has been very integral in the process of coordinating and gathering the information for the tender and also in establishing the program in the beginning. So thank you to Kay, and it's great to have you on the call today as well. As Charles mentioned, I'm the Area Manager for Central Coast and Hunter Baptist Care at Home. So our geography extends from the south end of the Central Coast, Woy Woy Peninsula area, to the north in Port Stephens, out to the west in Cessnock. And if you've got your favourite colouring in pencil handy and you colour in everywhere in between, that's our geography. Obviously, for this particular program, we're focusing specifically on the Newcastle LGA. So that fits neatly into the geography that we provide care and support to those aiming to stay at home and remain independent at home. And we're really excited to have the opportunity to be a part of this really exciting pilot and to be delivering that through our at-home service. So today's presentation will give you an overview of the program, and also obviously because it's a brand new program that we're looking to implement, help everybody to understand the specific parameters of the program and how people can get involved or refer clients along to the program as well. As Charles mentioned, it will be delivered by Baptist Care at Home, and the funding that has been provided to us is from the Hunter, New England Health and Central Coast Primary Health Network, otherwise known as the PHN, through the Australian Government's PHN program. As I mentioned before, it'll specifically be focusing on the Newcastle LGA. However, we will say from the outset that if you had a client who fit within the parameters and the criteria eligibility for this particular program, who was just outside of that LGA, we would encourage you to still reach out to us and discuss the possibility of that person perhaps being able to access some support from the program, because we are really interested to see what sort of numbers actually glean from those bordering suburbs around that Newcastle LGA as well. The support through the program will be for people diagnosed with a non-malignant life-limiting illness, and it's personalised care for during that end of life stage. The emphasis will be on coordinating and establishing links and referrals to other agencies for ongoing support. The care coordinators who are part of the program, we have employed people who have a clinical background, nursing background or a social work background, and lots of experience obviously in the palliative care space. However, they won't be specifically providing clinical work or clinical intervention with the clients. The role is a care coordination and facilitation role for the clients in the program. The aims and the objectives of the actual program are timely interventions for the clients who are part of the cohort, enhanced health literacy of the clients who are referred to us, support to access cultural and religious rituals, which we all know can be a very important part of this end of life stage for people, improved symptom management, increased empowerment and independence for clients, increased support and education for families and carers and those who are around as part of the circle for the person who is end of life, increasing involvement of family and carers in decision making and care planning, support clinicians to better understand their role in palliative care as well. The eligibility in terms of who would be eligible to be provided service or support by our care coordinators is that the person must have a diagnosis of a non-malignant life-limiting illness and be in the last 12 months of life, over 65 or 55 for First Nations people, living in the Newcastle LGA, but as I said before, if it's a closely bordering suburb, please don't hesitate to reach out to us as well. Experiencing financial hardship, limited or no social or family support, living in the community, that means that those living in residential aged care facilities are excluded from this particular pilot, and that the person wishes to be cared for and die at home where possible. Just so that we're all on the same page with regards to what constitutes a non-malignant life-limiting illness, you may have clients that you're already thinking of or people that you think you could refer to the program, and hopefully they fit into one of these categories. Perhaps the person has cardiovascular disease, Alzheimer's, diabetes and complications due to diabetes, HIV or AIDS, sepsis, end-stage kidney disease, other neurological diseases, multiple organ failure, stroke, respiratory failure, motor neurone disease, or end-stage liver disease. The role specifically of the end-of-life care coordinator, as I mentioned before, is a coordination or facilitation role. So it's not expressly clinical. However, having a clinical background and experience obviously helps the person to have a greater understanding of some of the jargon and some of the processes and specific information that is required to be understood around someone who is end of life. But specifically, the 6 areas that we see as part of the role of the care coordinator is that they could provide joint attendance to GP and specialist visits with the person who is end of life, and also potentially partnering with family or carers who are attending those visits as well. In those visits, they may provide an advocacy role. They may be able to retain information, ask questions on behalf of the client, and also to be able to take notes and obtain information if the client is finding it difficult to retain or understand that information at the time. Face-to-face client and carer education. So obviously when someone is walking through a particular end-of-life journey based on one of those non-malignant situations that we discussed previously, there's a lot of information that is provided from lots of different avenues and angles. So the ability to be able to sift through that information with a client and help the client to find the information that is most helpful for them, and to take the time to actually assist the client to understand and comprehend that information as well. Perhaps also if the client is finding it difficult to gain access to that information, that the care coordinator would be a conduit for being able to tap into local information, written resources, and improve the literacy and comprehension of that information for the client also. Also part of the role would be to support with referrals to specialist palliative care. We're currently working on a stakeholder network list for the care coordinators, establishing greater links and connections to any existing organisations who are providing support to palliative care patients or clients living at home within that Newcastle LGA. So if you're on the call today and you're part of any organisation who's already currently working in that space, please make sure to reach out to us via the email address at the end, because we'd love to hear about what you do and how we can partner with you in providing referrals to your organisations or services as well. And therefore the care coordinator being able to link clients with relevant team members and other contacts within the local Newcastle LGA. To support with referrals to relevant community allied health professionals as well, to assist the client with accessing a greater breadth of services for their end of life journey. Support to enable a client to prepare a will, appoint a power of attorney and enduring guardian. This can be a very complex beast for any of us who've ever had to navigate that space, and to have someone who is walking alongside the client, supporting them with the development of and review of advanced care plan and directive, and also navigating the process of accessing legal support in terms of preparing a will and the POA and enduring power of guardian as well. Very important processes for people in this space. The informal and incidental emotional support of client and family. Obviously, this is a big part of the care coordinator role, supporting the client with incidentals as they come up, being able to access different services, support access to things like My Health Record, etc., and be present for the client and their family or support network. With regards to the family and carer support and education, there's a few key things that we see as pivotal as part of the care coordinator's role and also as part of the pilot project. And they are that the person would be providing information and resources for the end of life process, helping families and carers understand and cope with grief and loss, and obviously providing appropriate referrals there to local support networks for that space as well. Supportive counselling and guidance, obviously once again, qualification and experience relevant, depending on the person who's in the role, and referring on to those in the local community who can provide that specialised support as well. Addressing concerns, fears and emotional needs of families and carers. Educational sessions are also a possibility as part of the care coordinator's role, providing end-of-life care, grief and bereavement for families, carers and staff members who are working around the particular client. The service delivery, the model is that it would be a 4 to 6 week service duration, flexible based on the client's need, and that the program would operate the service to meet the client's needs. So this, we recognise that this may include time outside of standard business hours, being evenings and weekends based on when family members or carers are available outside of work hours, or when the particular client actually feels most able to present ready for connection with the care coordinator. Most importantly, we want everyone to understand that the program is completely free. So these services are provided to clients, family and carers free of charge, thanks to the generous sponsorship of the PHN and the tender that we are providing the program through. Most importantly also with regards to the referral process, so if you have someone that you're currently thinking of who would be beneficial to discuss with us with regards to possibly accessing the service, referrals can be made by anybody, by clients themselves, by family members or carers, by medical staff or people who are currently working with a particular client, or by any other care team member who is currently aware of the clients that may actually benefit being a part of this program. To make a referral, you can use the 1300 number there, which takes you straight to our central intake line, and the person who answers on the other end will actually do some very brief intake processes with the person who's contacting, or you can contact our end of life care email directly, and we'll be able to organise a referral that way as well. That ends the formal part of our presentation today. So I'm going to hand back to Emily, who's going to run us through the health pathways as well. Thank you, Emily.
Thanks, Kate. I might just share my screen, just bear with me, sorry. Sorry, Phoebe, do you mind sending the screen sharing to me? What we might do, Charles, oh, here we go, sorry. Okay, so as Charles said, my name is Emily Parsons. I'm a project officer for the Health Pathways team, and I just wanted to share some information with you. So for those who are not familiar with Health Pathways, it's an online health information portal for GPs and other primary health clinicians to be used at the point of care. Provides information on how to assess and manage medical conditions and how to refer patients to local specialists and services in the most timely way. So on the screen here, you can see we have a QR code you can scan or use this address here. And I recommend to save it on your taskbar because there's lots of helpful information. We have a username and a password if it's the same. And then if I click on here, so for those who haven't seen it, this is the homepage of the Hunter New England Community Health Pathways. So you'll see here on the left-hand side is a table of content. For example, here you can see under public health, we have some information about disaster planning and management, or under child and youth health, we have, for example, dermatology. So each pathway on our website is created by a team of clinicians, including GPs, nurses, allied health and specialists who are on the ground working in that space. So we do have a range of clinical pathways, referral pages and resource pages. So I'll leave you to look at the clinical pathways. They discuss assessment, management and referral for particular conditions. We also have referral pages, which is relevant to this service. So if I type in here palliative care and go to the palliative care support services page, I can go to Newcastle, and this end of life care coordination in primary care program is here. So you can find information about the program, if you wanted to revise the criteria for referral, who can refer, where to refer, and just some extra information, plus a website that you could have a look at for some more information. So that's really helpful. There's also lots of different other referral pages for different conditions as well. So thank you, that's all. Thanks, Charles and Phoebe.
Thank you. So, thanks, Kate. That was a great presentation, really clear, concise overview of the service. If anyone does have any questions for Kate or Kay or Emily, please type them into the chat now, and we'll endeavour to answer them. We still have about 10 minutes left, so if you do have any burning questions, type them in now. As Phoebe mentioned, the webinar is being recorded, and that will become available on our PHN Education Library. So just jump onto our homepage, thepHN.com.au, and then click on For Health Professionals, and you'll see Education Library as an option in the menu. A lot of our education sessions are recorded and kept there, so if you have colleagues or anyone else that may have missed it today, please direct them to that recording. As it is a new pilot service, we're very keen to get the word out there and start generating referrals. From a PHN's perspective, as it is a pilot, we're obviously really keen to see some successful outcomes, and then you know, hopefully if we're looking at the potential for further federal funding, Commonwealth funding, we could look at building upon or expanding this program. So yeah, so there is a question that's come through. I'll just read it now. Yep, so Jamie has said, where can we find information about the service? Is there a website on the PHN page for those who need to find this information at the point of care? So I can answer part of that. So yeah, so obviously on Health Pathways, the information's there that Emily said. That we will add an extra link on our PHN website, and I might hand over to you, Kate, around the information that's on your website as well.
Yeah, fantastic. So yes, Jamie, we do have some information on our Baptist Care New South Wales and ACT website as well. However, I understand that off the back of today's presentation, the slides will actually be being sent out to all those who've attended as well. So all of that content that we've gone through today will be there also. If you had specific questions that you found you weren't able to find the answers to either in the presentation or via our website, please don't hesitate to reach out to us on the End of Life Care email address, and we'd be more than happy to discuss the specific questions that you have as well. Not a worry at all.
There's not another question, but I have a question that I could maybe ask on behalf of referrers. As you mentioned, it's a service just for non-malignant disease. What's the process if someone has a patient with cancer who may be suitable to access the service?
Yeah, Kay, I might pass that one to you.
Oh, yeah. We certainly wouldn't just turn them away. We would still support them and link them in with any of the pathways or any other referral organisations that we have links for, and see that through. And once they've settled with them, we'd pull out. They just wouldn't get the full benefit of this program, but we would certainly help them.
Great, thanks, Kay.
Charles, we also have a flyer that we can send to you. I'm not sure whether you can send it out or how you get that out to the people online today, but we've got a digital version and a hard copy of that too.
Great, yeah, and we can probably, because we'll have the slides up on our education library, we can pop the flyer up with that as well. So people, head to that and you'll be able to download that. And we can maybe have a look at or talk to Emily about having that linked on the Health Pathways page as well.
Perfect.
That would be good.
Thank you.
Okay. I don't think there's any other questions coming through for now. I think it's reflective of Kate's great presentation. You covered all the really useful information about the service. But yeah, of course, the PHN and Baptist Care are happy to answer any questions about the service, so please don't hesitate to reach out to us. So I might hand back to Phoebe.
Thank you. Kate, outstanding, really practical, really concise, and thank you so much for taking the time. Kay as well, always really good to meet you and super supportive throughout this process, so thank you. Charles, our star for bringing all of us together. Everyone for coming today, we really, really appreciate it. We understand that this is your precious lunch break, so we do appreciate you spending it with us. And also Emily for taking the time to present here today as well. I think we've covered everything. Good job, everyone, and look after yourselves. Thanks again.
Thanks so much.
Thanks, Phoebe. Thanks, everyone.
Bye.